Excuse me, Mr. Geo.
Yeah, what's up?
What does it take to become a champion?
You gotta dream, you gotta think, you gotta act, you gotta ball, you gotta bleed, and most important, you gotta believe.
You gotta dream like a champion, think like a champion, act like a champion, say I'm a champion. Soar like a champion, bleed like a champion, look in the mirror and believe you're a champion. You gotta dream like a champion, think like a champion.
You're tuned in to IChampionHealth Chats, the podcast for amplifying community voices and advancing health for all in Lexington, Kentucky. Each episode connects you with local champions who bring powerful stories, useful tools, and fresh ways we can show up for ourselves and others. Let's lock in and learn how we can champion health together. Welcome, listeners and viewers. I am excited to announce a special crossover season that brings together voices from across our community. I am Gerald Gibson, founder and executive director of Operation Making a Change, and I'm the host of IChampionHealth Chats, a podcast where we explore real stories and fresh ideas to advance health for all across Lexington. And I'm also excited to announce I am joined by someone whose leadership helped make this collaboration possible.
Thanks, Gio. I'm Dr. Abini Elamine, co-founder of Project Ricochet and host of The Ricochet Effect, a podcast about community leadership and the impact of local action. What you're about to hear was recorded live at the 2025 Central Kentucky Black Family Conference, an event I had the privilege of helping bring to life. The conference brought people together from all walks of life, families, leaders, and neighbors, to focus on health, connection, and building stronger communities through conversation and shared experience.
This year, the IChampionHealth Initiative and Project Ricochet teamed up with something special, a joint series of community interviews we're calling the Talking Drum. The name comes from the West African tradition of using drums to share messages across villages, passing along important stories and bringing people together. And that's exactly what you'll hear in this series.
Across this series, you'll hear from youth, professionals, and artists, people who make Lexington the community it is. These conversations were led by Mr. Gio and Terry Dumphord from the Voyage Movement and also the Ricochet Effect podcast as a co-host. They dive into personal stories about health, leadership, family, and life's everyday moments, both the joyful and the challenging. These conversations are honest, thoughtful, and deeply rooted in shared experience.
These stories are full of real insights and lived moments that remind us what it means to be part of a strong, caring community. Whether you were part of the event or you're just now tuning in, this series is a chance to reflect, connect, and hear what matters most straight from the people in our community.
We want to thank every guest who shared their voice and the entire conference team for creating a space where these conversations could happen. Make sure to follow #IChampionHealthChats and the Ricochet Effect podcast at WUKY so you don't miss any part of the Talking Drum series and other future episodes. Now, let's take a moment to listen and celebrate what makes our community strong.
Good morning, everybody, and welcome to another episode of IChampionHealth Chats. I am your host, Gerald Gibson, and today I will be collaborating with Terry Dumphord, who is a part of the Ricochet Effect.
Hey, how y'all doing? Good morning.
Right.
So we have our first guest today. Ma'am, can you tell the people what your name is and then a little bit about what you do?
Absolutely. My name is Gerri Botts Stuart.
Good morning, Gerri.
Good morning.
Hey
It's
there.
a lovely morning, and I'm with Bluegrass Care Navigators. I am under their umbrella of services, which is PACE, Bluegrass Pace Care, and I am responsible for the outreach coordination for that program.
Okay,
nice.
All right. So, Gerri, I'm familiar with your work, and we've been collaborating for a long period of time.
Yes.
And what I want to know is today is what does community mean to you? Because you're doing a lot of community work. You're boots on the
Yes.
ground. So,
Yes.
but what does that look like to you?
To me, what it looks like is looking at the broad community and breaking it down to the individual. It is providing service to the individual, then spreading it out to the family. And once you have the family, the neighborhood, and then the neighborhoods makes up the community. So in other words, serving all the way from micro all the way out.
Okay.
Absolutely.
Good. I like how you broaden that out for our listeners and our viewers.
Yeah, I definitely appreciate all the work that you do. Consider you a community partner. We've worked together a lot on a lot of different levels. So thank you for all that you do.
Thank you all.
My question would be, what gives you hope right now in our community?
What gives me hope is knowing that no matter what is going on around us, that we can still find community, meaning our community and unity. We can come together to build strength. We can come together to keep moving forward, and it's about serving each other, right? I can't just pour out. I have to be poured into. So it's about looking in the mirror, making sure that I'm where I need to be, but then looking out the window and making sure that my community is as well.
Okay.
Absolutely.
Sounds like it's a lot of self-reflecting in there.
Absolutely.
People definitely always got to take a look at themselves. So, we've been going through a lot in our communities lately. A lot of mental health, a lot of trauma, violence on all levels, whether it's substance, whether it's gun violence, domestic, you name it. What does healing look like for our people? And who are the most people that you do serve, but what does that look like for our people, healing?
Right. I think healing is difficult. I'm going to be honest. I think it's about standing toe-to-toe with whatever you faced in your past that's being re-triggered, as well as what you're going through now. Once you stand toe-to-toe with it and you own it, then you say, I might not have been responsible for this, but I am responsible for my own healing. So then it's being referred to the right places, the right people to be able to help you walk through that without judgment. It's owning, this is how I feel. I don't have to judge how I feel. This is where I am. The population that pays service is age 55 and older. So when I look at that, I look at myself being 61, and I look at all the different things I've lived through, and I see where we are now. It's scary. So I have to own that and not judge it. But how do we move forward?
You're not 61, though, are you?
I am.
You're pulling our legs.
No, I'm 61.
Okay, well, you're wearing the well, Queen.
Yes.
Thank you.
Okay.
Let me see. How can I follow that up? If you don't mind, can you share a moment when you saw your advocacy make a real impact in someone's life?
Oh, absolutely. Without anything that would let you know who they are, I had done a home visit with someone, and when I walked in, they had a lot of needs. They had a lot of needs emotionally. They had needs financially. They had, physically across the board. And when I said, hey, I believe we can help and let me work with you, and walking step to step, not just saying, here's what we do, but here's how you navigate. Here's some other resources. And I look at them today, and they are doing well. Physically, they're a lot more mobile. Mentally, they are reporting, you know what, I'm not as depressed. I'm not as isolated because now I have socialization. Medically, they're doing great because they're getting all those services met. It's just across the board. And to me, that's encouraging. When there's a hard day and I go into our PACE center and I see not only that individual, but several, and I remember where they were and where they are now, it keeps me going.
Absolutely.
That's my fuel.
So it sounds like the community, they're embracing the resources that you and your agency are laying out for them.
Right.
Well, that's good.
Ours that are in-house, as well as always, as you know, referring out-of-house, because they
something
need.
difficult in the beginning? You know how sometimes we can go in communities and we can say, here, we have these resources, How did y'all even know what the community wanted before you even...
You have to listen. It
Okay.
starts with listening. Hey, and it's even now when I speak with someone, instead of starting with, we can do this, and that, I say, tell me about you. Tell me about what you faced and what you're facing now. And then I can plug in from what they say. I think we may be able to help in this area, or I know someone that can help in that. You can't go in and tell someone what they need. You need to listen.
Absolutely.
I hope all our listeners and viewers are taking notes right now. To go into a community, it's important that we all listen to see what the community wants in order to create that unity and build that trust. Okay?
Absolutely. Thank you so much for your time.
Thank
we
you
appreciate you, and we will see you inside the conference.
Absolutely.
All
Thank
right.
you, and thank you for your great partnership.
God bless you.
All right, you as well.
Thanks for tuning in to IChampionHealth Chats. If something you heard in this episode spoke to you, don't forget to follow us and share it with your community. You can find us on social media at IChampionHealth or email us at ichampionhealth@uky.edu. IChampionHealth is a collaboration between UK Prevent Community Engage Alliance and Operation Making a Change. This season of the podcast was supported by UK Healthcare's Healthy Kentucky initiative. The information shared here is from the IChampionHealth team or our guests. These views do not necessarily represent the official position of or endorsement by UK Healthcare. You can explore wellness resources from UK Healthcare and a free suicide prevention training at kyqpr.ukhc.org.